I think everyone can hear me okay through the microphone. All right. My name is Justin Nealis, and my company is called Perfect Timing Insurance. And I just want to thank all of y'all for coming out here today and giving me the opportunity to speak with you about health insurance and your different options. If you have any questions, just ask. I will try to answer them to the best of my ability. If there's something I don't know the answer to, I will find the answer for you. So what I'm going to do is just kind of go over the services that I offer. I compressed a lot of information into about 30 slides for everyone. So just feel free to ask questions if you have them along the way, and we'll just kind of go from there. And I have a translation here. I don't know how accurate it is.
If you can read it.
So,
can you just give me 1 second
yeah.
to interpret it? يعني
Yeah,
هو بيقدم.
if anybody needs العربي يرفع ايده وجدة ممكن
نقعد جنب هنا اهو.
ممكن جدة
انت كله تمام
لو في تعبير معين if there is expression
تعال هنا.
ارفع ايدك مفيش مشكلة.
هو بيعرف اسمه ان هو جاستن هو
Make
تبع
sure everybody understands him.
Okay, good. Yeah.
We can do it as slow as we need to go, so no rush over here. I have a full belly, so I'm good to go.
Oh, you do?
Yeah. So when it comes to health insurance, you basically have health insurance for under 65 and over 65. And my company, we help people sign up for insurance for the Affordable Care Act. I don't know if y'all can read that, but Affordable Care Act health insurance is also known as Obamacare, most commonly known. We also provide services for Medicare Advantage, Medicare supplements, and Medicare is for individuals that are 65 and older or have a disability in America. And then I'm also going to go over some ancillary products like hospital indemnity, dental, vision, and hearing, cancer, heart attack, and stroke policies, and final expense and life insurance. And just ask questions as they come. So Affordable Care Act health insurance, it changed a lot of things, and one of the biggest changes it brought to Americans was that it enabled us or people to get coverage with pre-existing conditions. You cannot be denied health insurance for a pre-existing condition like diabetes or congestive heart failure or cardiovascular disease. These insurance plans are going to cover 10 essential health benefits ranging from emergency care and hospitalization to maternity, newborn care, mental health services, prescription drugs, and preventative care. Affordable Care Act health insurance, what a lot of people don't know about it is that there are subsidies and tax credits available to individuals, and that's going to help people afford the insurance that may not be able to afford it. Yes. Yep.
الفرق الوحيد مش الفرق الوحيد التغيير اللي اتعمل ان هو الناس اللي عندها حاجات صحيه كان زمان الانشورنس بيرفض ان هو يعمل لهم كفرج لان هم كان عنده سكر كان جاله ضغط كان جاله قلب whatever كانوش بيرضوا يعملوا له انشورنس لو شغل جديد مثلا كده. دلوقتي تحت اوباما كير غصب عنهم لازم يكفر يوم ما يقدرش يقول لك لا عشان انت كنت عيان بحاجه قبل كده لانهم بيخافوا من العيانين دول هيكلفوهم اكتر. الحاجه الثانيه هم بيكفروا حاجات كتيره جدا. الحاجه الثانيه انه الحكومه اللي دخله واطي بتدفع جزء او كل من المصاريف الشهريه اللي هي الاشتراك الشهري في الانشورنس البريميومز سبسيدايزد بيغطوها زي اللي هو في مصر بيسموه التامين. مش التامين اللي بتعمله الحكومه في الجمعيه اسمه ايه الدعم. بتدعم الانشورنس بتاعك فالمصاريف ما بتبقاش عليك حتى لو في الاول بانت غاليه $300 في الشهر ممكن تنزل $50 $10 لزيرو حسب دخلك وحسب ظروفك. وكمان اللي بتدفعه ده مش بيتشال من دخلك فبيقلل من دخلك قدام الضرائب. يعني انت هتدفع $50 50 من دخلك فالضرائب مش هتحاسبك عليها اخر السنه. Thank you. Sorry about that.
All right, so there's something called an advanced premium tax credit that's available to individuals, and these advanced premium tax credits are going to be what lowers your cost of the health insurance because Obamacare is pretty expensive for most people. And the premium tax credits are available for individuals' incomes are from 100% to 400% of the federal poverty level. And the tax credits are, they are managed by your household income, this amount of dependents that you're claiming on your taxes, and also if you're used tobacco or not. If your income is too low, you will be directed to Medicaid or the CHIP, which is Child's Health Insurance Program. And in North Carolina, Medicaid expanded to 138% of the federal poverty level, where other states is at 100% of the poverty level. And children in higher income brackets can get child's health insurance plans or children's nutrition program as well. And Medicaid may be available to pregnant moms, and those infants could be eligible even in non-Medicaid expanded states. So when it comes to employers, I just wanted to touch on some of this, basically deciding to do an individual plan or group health plan. So employers with 50 or more employees do not, if they do not offer coverage, they will have to pay a penalty. Employers with less than 50 employees do not have to offer a group health plan, and they will not be penalized. If they do offer a group health plan that is not affordable, they will pay a penalty. You can get individual plans to the employees, but in the past, employers could not pay for the coverage or get a tax benefit from the cost. Now there are new HRAs available to employers to help employees afford health insurance. That's too expensive. So there are subsidies available to the dependents who cannot afford the group health coverage of their parent or their partner. So if you have children and it's too expensive for them to afford the health care coverage underneath your group health insurance plan from your employer, there are tax credits and subsidies available for the children. For the dependents. For Affordable Care Act, 24 years old. So a child can be up to 24 to be underneath their parents' insurance. Mm-hmm.
Over 24 and still living with you.
I'm sorry.
If it's over 24 and still living with you.
If it's over 24
and still living with you.
And still living with you, then they would need to get their own health insurance after 24 years old. They would have to acquire their insurance for themselves.
They cannot be covered.
Mm-hmm. Yeah, they can't be covered after 24 underneath their parents.
But I see if there's no difference between the first option and second option, because both of them will get the credit from the government. So
Mm-hmm.
what's the difference between the advanced premium and advanced what?
Advanced premium tax credits.
And the ACA.
So ACA is just the name of the insurance, Affordable Care Act health insurance. And then advanced premium tax credits is just how they define the tax credits that they provide. So if you had a family, let's say you had 3 kids that were 24 years or 22, 23, 24, and then your 24-year-old came off of their insurance. So instead of the parents getting the tax credits for their family plan, then the a child would get their own tax credits. They would have their own health insurance. So Affordable Care Act health insurance, you can have a family plan, you can have an individual plan. You can have a group health plan with employers. So you have different types of coverage, if that makes any sense.
And both of them, they gave you credit from your tax.
Depends on your income level and the amount of dependents.
And even if my kids is over 24 and is not working, you can also get a tax credit for his insurance plan?
Correct. So if, let's say, for example, if someone has a child who's over 24 years old, let's say they don't have any income, then they would qualify for Medicaid, most likely. And what Medicaid does, it provides health insurance to individuals who don't have the resources or income to afford health insurance. So the federal poverty level for a single person is just over $15,000. So the tax credits are available up to 400% of the federal poverty level. So let's just say for an individual could make just under $60,000 per year and still get some tax credits from the government to help them afford the health insurance. So if you're looking at a health plan for the family, let's say you have mother, wife, 3 children, the way they determine the amount of your tax credit, they're going to look at the combined income for the family. So if the husband and the wife file taxes together, and if they claim the dependents, the amount of dependents and the amount of income is going to determine if they have a tax credit available to them. Does that make sense? Okay.
And there is like a schedule for the house family size and how much credit you're gonna take, or
It would be, they might have some type of schedule. It's really easy to get a quote for someone. So if someone, or you were like, hey, Justin, I'd like to get a quote for my family, I would just get your age and your wife's age and the income for both of you, the dependents, their ages, and I can get a quote in less than 10 minutes. And then it'll provide me with if you have a tax credit or not. And if you do have a tax credit, it will tell me how much the tax credit will be.
and what will be the situation if like my wife, she has her health insurance with her employer, but if I get health with her under her needs, she's gonna be too much for her to pay. But my employer doesn't offer me any kind of health insurance, so I can go over to the place for the Obamacare.
You can.
In this case, I have to join my income together with my wife, or just for me, my income only?
So if you can't get insurance through your wife's group health plan, then they're going to be looking at your income.
Just me?
Mm-hmm. For the tax credit.
When they ask me about my income, I have to mention just my income only, not combined together.
Yes. Yep. So.
And even also if my employer offered me a health plan, but it's too much money, it's cost me a lot, so I have to go to the marketplace.
You would have, yeah, if it was too expensive underneath your employer, then you would go to the marketplace, which I'm going to go over that here right now about what the employer has to follow for their rules for health insurance. Okay.
Listen, I had to interrupt, but you know better, I'm sure. But just
Yeah.
to clarify, I was told that you can cover your child up to age 26, not 24.
So is it 26? You
So
might be right.
yeah, you can cover your child until 26.
Is it?
So I don't want to correct you, but
You might be right. I might have got the number wrong.
no, different rules apply. So
Yeah, that's what I thought it's
Yeah.
something.
I think you probably are right, actually. So let me double check that.
I mean, 2 years difference is not much, but better than nothing.
Yeah, no, I will check. I might have had the number wrong. I think it might be 26. I will double check that for you before I leave. I'll check it.
But by the way, Obamacare, it is the same marketplace or is it different?
Same.
Okay.
Obamacare, Affordable Care Act, Marketplace, it's all the same.
All the same. Okay.
Mm-hmm. It's all the same.
Thank you for asking this question.
No problem.
That's a good, everybody was confused.
Yes, sir.
All right. So employers that have 50 or more employees, they must offer an affordable qualifying group health plan, or they'll pay an employer mandate penalty. So the lowest cost self-only coverage option available to employees cannot exceed 8.39% of the employee's household income. So if you have a group health plan from an employer who has 50 or more employees and they offer you insurance and your insurance premium is higher than 8.39% of your household income, then they will,
Income or household income?
the household income.
But my wife, she has her
Yes. So it is the combined household income.
Even if my wife, she has her own insurance?
Mm-hmm. It is, yeah. So that, yes, it is the household income. So when let me go back. So when you ask me, it's individual, sorry, it's the whole household for Affordable Care Act. Even if your wife has insurance, it's not individual. Yeah, it's the whole household is what they're looking at.
If your wife makes $1 million, they can really, it's still affordable for you. So they have to look at this.
My question is, if my wife, she has her insurance.
Has nothing to do. They are looking for your income to decide is it affordable to you or not.
My income was my wife or with me?
Both of you, because still it's in the same household. So but there is a lot of
Yeah, there's a lot of it,
details there.
Yeah, there's a lot of rules and regulations to it. So, and forgive me for messing up the age. I believe it is 26, not 24. I apologize. So basically, if the employer does not provide affordable health insurance, an employer who has 50 or more employees, they'll incur a large penalty from the government, and they want to avoid that penalty. Now, what happens as well, like if the dependents, let's say the dependents, the children or the wife, whoever's depending on underneath the plan, if their health insurance is costs more than 8.39% of the total household income for the child, then child can get premium tax credits, and they don't have to do the group health plan. They can do regular marketplace health insurance. Let's see here. So employers with less than 50 people, that many times they can drop their group health plan. They don't have to offer one, and they can pay the employees more, and the employees can pay less for health insurance independently sometimes than having a group health plan. So sometimes for an employer with 50 or less employees, it's more affordable for the employees to have their own health insurance plan. And I'll go into some of the credits that the employers can receive by providing income to the employees to help them afford their health insurance.
Can I translate quickly?
Mm-hmm.
So basically الشركات اللي فيها موظفين اقل من 50 موظف ممكن ما يدوش هيلث انشورنس وانت تروح يعني مع نفسك، ممكن يدوا لك مرتب شويه زياده وتروح تشتري انت مع نفسك هيلث انشورنس. ده مش مفروض عليهم. اي شركه فيها 50 موظف او اكتر غصب عنهم لازم يدوا لك هيلث انشورنس، ولو ما عملوش الحكومه هتغرمهم. من حق يعني من مصلحتهم ان هم مصنع كتير. طيب ما هم
ايوه بس الانسولين مش عامله غالي اكيد طبعا. غالي صح؟ غالي عشان تعمل لمبه.
المصنع عملت واحد بس عملين لي هم حاجه زي السنان بدفع 50% مثلا.
السنان عندي حاجه ثانيه. وانا بتكلم عن الجسم.
Yeah, he's just talking about he's working in a factory.
Mm-hmm.
They have more than 50 employees,
Okay.
but the premiums are so high. So he did his own through the marketplace.
Okay.
But he has trouble with the dental, and
Yeah.
because dental stuff is not like a killing fatal thing, so it's not included usually. And it's more the premiums there is kind of varies a lot depending on the But yeah.
So yeah, if he works for an employee with 50 or more employees, and if his rate of insurance is 8.39% of his total income, that employer will receive a penalty for that.
But the 8.39,
Mm-hmm.
this is not per person. This is average, right?
No, this is per person. So it applies to him, applies to his wife, applies to his children. So
what he pays is different from his coworker who is receiving higher pay?
maybe, yeah. Mm-hmm. So it depends on the plan that they also want as well. So if It depends on, no, they might, okay, let me back up. The employees might pay the same, but if they make, their income might be different, right? So $1,000 might be more than 8.39% of the employee's health come, 1,000 times 12, right? And out of their income might be might be more than 8.39%. Whereas someone else that makes more money, it will be less. So they may pay the same, but the percentage of their income might be different because their income's different.
And who's covering the difference? The employer?
So no, so if the employer, maybe I'm not saying this right. If the employer, if the health insurance is more than that 8.39%, the employer gets penalized. They have to make it affordable for the employee. Yeah, if he's not making it affordable for him, then we should look at what the premium is for his health insurance and then look at the income that he's bringing in. So his health insurance also might be different depending upon, his health, his age, how many dependents he may have, how many people he wants underneath his health insurance plan too. So if the health insurance is 8.39% of the total household income, more than for the wife or the children, then the wife and the children can apply for Affordable Care Act and get a tax credit. If that makes any sense. Now, employers they can offer individual, they call it ICHRA, individual coverage health reimbursement arrangement. And what it is, it's available to businesses of any size, and the employers can reimburse the employees for individual health insurance premiums or qualified medical expenses. The flexibility is that employers can design these ICHRA plans to offer different amounts of reimbursement based on factors like job, class, age, and family size. They have to meet the ACA compliant, well, it does meet the ACA compliance requirements by offering tax advantages and a way to provide health insurance. There's no contribution limits for ICHRA, and it's the employee's choice to purchase their own individual health coverage to qualify for the reimbursement. There's also something called QSHARA, which is for qualified small employers health reimbursement arrangements. The focus is on small businesses. It's only available to employers with 50 or less employees. And it's a tax-free reimbursement, and they can contribute a certain amount of money each year to an individual or a family of the employee and to help them afford their health insurance. So let's say the family would go get regular health insurance, marketplace health insurance, and the employer would contribute X amount of dollars per year. So for 2024, the IRS set annual contribution limits. It's $5,850 for an individual for 12 months and $11,800 for families for 12 months. And it's a much easier setup for employers, and they can offer, basically it has fewer administrative requirements than the ICHRA does, so it's just a lot easier for small employers to utilize this if they can't offer a group health plan. Income is defined by line 11, by line 10 on your taxes. If a child's receiving supplemental Social Security income, it's not considered income for the family. And it's the same as child support. And if the child has their parent listed as a dependent and the parent is on Social Security, it is considered income. Social Security disability income does not count as income, and neither does alimony. Foreigners can get a subsidy as long as they have a green card and or proof of citizenship or legal residence. And you can put their alien number and credentials to skip the approval process. And going back to the age limit, it is 26. So forgive me, I double checked that. So to be on the parents' health insurance. And now there's something called Insurance for Healthy Americans. This is a private health insurance, and it's specifically designed for individuals who are self-employed they're healthy and they're high income earners. There is a full underwriting process to undergo to be qualified for these health insurance plans. And they do have the 10 essential benefits of a Affordable Care Act health insurance. And you cannot be denied the insurance for pre-existing limitations. It's available in 49 states except for Washington. And for Affordable Care Act health insurance, Obamacare, Marketplace, however you hear it, there's basically 5 plans. They call them kind of like Ferrari plans. They're all really, really good plans at the end of the day. You have bronze, silver, gold, platinum, and catastrophic. Your bronze plans have higher co-insurances and out-of-pockets, have fewer co-pays, if any. Your silver plans have a higher co-insurance and some lower deductible options and out-of-pocket expenses and some co-pays. Your gold has a lower co-insurance and out-of-pocket and more co-pays. Platinum is not offered by a lot of people or individuals, a lower co-insurance, co-pays, and out-of-pockets. And catastrophic is a high deductible plan. Let's see. And the maximum out-of-pocket for any Marketplace health insurance plan is $8,150 for an individual and $16,300 for a family. This is for, so if you have a Marketplace or Affordable Care Act health insurance, the maximum amount of pocket is the maximum amount of money that you would spend in a 12-month period underneath that health insurance plan before the health insurance company comes in and pays for everything. So if an individual has an individual plan, that maximum they'll spend in 1 year is $8,150. And for a family, it's $16,300. So to reach that max amount of pocket, you have to have a serious injury or illness happen to you to be in the hospital and incur the cost of an ambulance and an inpatient hospital stay and medication and therapy and all these other things that come along with sometimes a serious injury or illness.
So this maximum out-of-pocket is across all 5 plans?
Correct, yes.
But it can be different, less or...
Could be less, yes.
Less if it's you're in a plan that has less maximum out-of-pocket.
Correct.
Higher premium.
Yes, correct.
الافوردبل كير اكت عنده 5 different levels. حاجه تدفع بريميومز اكتر هتقلل عليك الكوباي، في حد اقصى للمصاريف. لو انت وصلت لحد الاقصى، لو مثلا حد حصلت له حادثه دخل مستشفى، الفاتوره $10,000. ال 8,000 الاولى دي طلع من جيبك، واي حاجه بعد كده تحصل طول السنه هم هيدفعوها، مفيش مشكله. الحد الاقصى 8,000، مش هيزيد عن 8,000 وكسور طبعا، مش من غير قياس. ال 8,000 دي ممكن تبقى اقل لو انت اخترت حاجه من الحاجات اللي هي البريميومز الشهريه بتاعتك اكتر، لان هو بياخدها بيجيب لهاش. كل ما دفعت اكتر كل شهر كل ما
مش هتدفع قد اسماء.
بس الحد الاقصى بتاع المصايب يعني متغطي.
So this kind of sums up mostly everything I've talked about. So Affordable Care Act health insurance, ACA health insurance, you'll hear different names for it. You have family plans, there are networks, and there are advanced premium tax credits. So there's 2 different types of networks when it comes to health insurance. You may or may not know. One is called an HMO network. The other one's called a PPO network. And the HMO network means Health Maintenance Organization. And basically you have to stay in that network to receive services at a reduced rate. If you go outside of that network, you'll incur the full cost of services. A PPO network is a preferred providers organization, and it's more flexible. If you can go in the network and you can go out of the network. If you go outside the network, there will be a higher premium or copay, but you won't incur the full cost of the services.
في حاجتين، في حاجه اسمها HMO وفي PPO. ال HMO ديت هم بيحددوا لك الدكاتره اللي ممكن تروح. لكن لو انت عايز تشوف دكاتره في منطقه اخرى او دكاتره مفتوحه شويه اسمها PPO، ودي تدفع فيها اكتر شويه.
هو بيزك الاتش ام او النتورك الدكاتره بتوعهم انت ملزم بيهم، لو طلعت بره مش هيدفعوا لك ولا مليون. البي بي او ممكن تختار من الدكاتره بتوعهم هتدفع شويه. لو طلعت بره مش زي الاتش ام او، هيدفعوا لك بس هيدفعوا لك حاجه بسيطه، هيبقى الجزء اللي عليك اكتر. لو الاتش ام او لو $100 الدكتور اللي بره النتورك بتاعهم هتدفعها كلها مجانا. في البي بي او مع النتورك بتاعتهم هتدفع مثلا $20، في الدكتور اللي بره هتدفع مثلا 40 50. بي بي او فيها مور فلكسبيليتي.
يعني معناها
الاتش ام او ما فيهاش فلكسبيليتي، كله عليك او لا.
انت اخترت بي بي او.
I always try to give examples in actual numbers to simplify it because
Yeah.
percentages doesn't make more easy to people to understand.
It
So
doesn't.
I try to put simple examples in simple numbers to,
Understand.
yeah.
So yeah, and something too, so the HMO plan, most of the ACA plans are HMOs, most of them. And HMO plans typically have more robust benefits because they take the money that's used for PPOs for larger networks and they put them back into the plans. So PPOs might usually have a little bit higher copay, maybe a higher co-insurance, but they're more flexible, where the HMOs might have a little bit lower of copays and co-insurances because you just have one network. So they put the money back into. Yes, the hospitals, doctors, and physicians and specialists. So overall, Affordable Care Act, you have family plans, individual plans, group health plans. They have 10 essential benefits to be qualified as a to be termed as a qualified group health insurance or qualified health plan. There are 5 Ferrari plans. You have carrier networks. There are advanced premium tax credits and subsidies. There's guaranteed coverage. You cannot be denied coverage based on any pre-existing condition, and they're mostly HMO networks. For the Affordable Care Act health insurance, there are subsidies and there's Medicaid available. So the tax credits are available up to 400% of the federal poverty level. There's cost sharing reduction for up to 250% of the federal poverty level. North Carolina's Medicaid is available from 0 to 138% of the federal poverty level. And for Medicaid available for children is through CHIP, Children's Health Insurance Program. There's QSHARA and ICRA available for employers to use to help their employees afford health insurance. And 50% of clients pay a $0 premium on Affordable Care Act health insurance. And 80% of clients that enroll in healthcare.gov usually find a plan for $10 or less. These health insurance plans do not include dental, vision, hearing. They don't include long-term care or custodial care or home health care or hospice, and also do not cover care received outside of the United States.
If it is a different state within the United States, it's okay? You cover it?
So if you, let's say you have health insurance in North Carolina and you have a HMO network or a PPO network, and you go to New York and you get hurt and you go to the hospital has to accept your insurance in the event of an emergency. So you will be covered. But if you go to try to see like a primary care physician in a different state, you're not going to be covered. So the enrollment period for Affordable Care Act health insurance is November 1st to January 15th. That's when everyone enrolls into their health insurance plan for the following year. Now with Affordable Care Act health insurance, there are a lot of special election periods. We call them SEPs, special enrollment periods. And so with ACA, you have getting married or divorced, having a child or adopting a child, if you move, if you lose your job, if you lose your group health plan or COBRA coverage, if your policy ages out, if you lose your Medicaid or CHIP, if you have ICRA or QSHARA benefits coming, if you're recognized by a tribe in the United States, if you're incarcerated or the household income changes or the policy ends, or if you're a new citizen to the United States, it creates a special enrollment period. And what that does, that enables you, it gives you 60 days to apply for health insurance.
ده بيتكلم على الانرولمنت بيريود بتتفتح من اول نوفمبر لغايه 15 يناير. دي الفتره اللي ممكن تشترك فيها في الافوردبل كير اكت. لو بعد كده في ظروف معينه بيسمحوا لك تشترك رغم انها بره الفتره دي. لو اتجوزت، خلفت عيل جديد، بنيت عيل، فقدت شغلك، فقدت الكبره بتاعتك، في ظروف يعني معينه بيسمحوا لك تشترك حتى لو انت outside الانرولمنت بيريود.
So I'm going to go over Medicare as well. I don't think there's anyone here that's 65. But I will go over this. I don't want to bore you to death with it, but it's good to know for family members that are going to be turning 65 years old, okay, or disabled. So basically what Medicare is it's health insurance for older and disabled Americans, and currently it serves 62.8 million people in America. It's individual insurance, which can be really confusing if you're used to having a group health plan and you have your dependents or your children underneath you. So it's only for an individual, it's not for a family. Medicare is. And Medicare is also different from Social Security, and it's different from Medicaid. Often people get Medicaid and Medicare mixed up. It happens a lot. So Medicaid is health insurance for people with limited income and resources. Medicare is for 65 and older and disabled individuals.
Medicare, they have to work, they have to be working in America.
Yes, so I'll get into that in a little bit on how to qualify for it, or who it's available for. So, well, as we say that, so who can get Medicare? Medicare is available to, there's only 4 ways to get Medicare. If you turn 65, if you're on Social Security disability income, on the 25th month, you get automatically enrolled in Medicare. If you have something called ALS, which I'm sure most people are aware of, and or end-stage renal disease, which is kidney failure. So if you have any of those 4 things, then you can be put on Medicare. Outside of that, it's not available to anyone else. So each person gets their individual Medicare card, and they get an assigned Medicare beneficiary number to that person, kind of like your Social Security number or tax ID number. So it's specific to you. Now, with Medicare, original Medicare, there are 2 parts to it. You have Part A, you have Part B. There is no network for original Medicare. Anyone that accepts Medicare, any doctor will accept original Medicare. Any hospital across the nation has to accept your Medicare insurance. All right, there's no drug coverage with original Medicare, and there's no structured stop loss, which means the amount of money that you could pay in the event of a serious illness or injury in 1 year can go as far as the sky. So there's no stop loss for that. There's 2 parts of original Medicare. You have Part A and you have Part B. Part A is your hospital insurance. And in order to get Part A with no premium, you have to have worked in the United States for 10 years and have 40 credits of work history, which is a credit per quarter. If you are a stay-at-home father or a stay-at-home mother, you can borrow the tax credits from your husband or wife if you don't have the history here. Even if you've been divorced, you can borrow the tax credits, but you have to have been married for 10 years minimum. If you have the tax credits, Part A is premium free. So Part A is going to cover your hospital room and board. There's a $1,632 admission deductible if you go into the hospital. Part A is also going to cover home health care, skilled nursing facilities, and hospice care. Then Part B is your medical insurance. Everyone pays a premium for medical insurance. For 2024, it's $174.70 per month. And that premium could change based on your income. They call it IRMAA, I-R-M-A-A, which is income-related monthly adjustment amount. So once individuals, I think the first adjustment is at $103,000 for an individual there, and they look back 2 years on your taxes, and they look at your income, and if your income has it reaches a certain bracket, you'll pay more for your Part B premium than anybody else. So there's also a $240 annual deductible with Part B, and 80%, after you pay your deductible, 80% is covered by Part B and 20% is covered by the individual. And there's no structured stop loss for Part B. And Part B is going to cover most commonly your doctors, outpatient services, labs, cancer medication, therapy, durable medical equipment, and I could probably go on and on for a while, but that's generally most of the things that it covers. Original Medicare does not include prescription drugs, routine dental or vision care, long-term or custodial care, or excess charges by doctors who don't accept a Medicare assignment, or care received outside of the United States. So Part C is known as Medicare Advantage, okay? And what Medicare Advantage is, it's an alternative to Original Medicare. It doesn't replace it. You still have Original Medicare. What it does is Medicare contracts with the plan to administer your Part A and your Part B. So Medicare Advantage is only offered by private health insurance companies, and their plans are going to depend on your county or your state or your zip code. And most plans do include prescription medication coverage, dental, vision, hearing, and other benefits as well. And you get all your benefits covered by your plan. So to try to make it really simple, Medicare Advantage has carrier networks, it has drug coverage, and it has a structured stop loss. So what Medicare Advantage does, it takes your Part A, your hospital, your Part B, your medical, and it combines it with Part D, which I'll go over in a moment, which is prescription drugs, and it puts it into one package, and the health insurance company administers all your benefits. And often it includes dental, vision, and hearing. So it covers Part A, your hospital, Part B, your medical, Part D, prescription drugs. There are either HMO networks or PPO networks, and there's something called the maximum out of pocket with your Medicare health insurance. And your maximum out of pocket is the maximum amount of money that you would spend in 1 year underneath Parts A and B in 12 months before the health insurance company comes in and pays for everything. So basically, you'll hit your maximum out of pocket if there's a very serious illness or injury. Less than 1% of the population reaches that maximum out of pocket because you basically have to get hurt or get sick, basically. Let's see. Medicare Advantage policies usually don't have a premium. So you just pay your Part B premium, $174.70. Get your Medicare Advantage plan. You don't pay extra for prescription drug coverage or the dental, vision, and hearing benefits. It's all included into one plan. And often they do have, well, every Medicare Advantage plan has a fitness benefit associated with it, where you can be a part of a fitness network of gyms that you can go to throughout the nation. Sometimes they provide grocery money and over-the-counter benefits, and sometimes they provide transportation too. So Part D is prescription drug coverage, easy to remember, D for drugs. There are types of drugs that are most commonly prescribed for Medicare beneficiaries as determined by federal standards. So every health insurance company has to cover X amount of drugs underneath federal standards, and every health insurance company has a different formulary, and what that formulary is, it's the prescription medications that they cover, and it's all based on tiers, and the tiers are based on the money of the medication. So tiers 1 and 2 are mostly very common drugs like blood pressure medication, cholesterol, stuff like that. Tiers 3, 4, and 5 usually cover more specialty medication and things that are a little bit more expensive. And there can also be deductibles for each tier. So there could be a deductible for tiers 3 through 5, but not for 1 through 2, which is very common now coming for 2025. And they changed the drug plan significantly for 2025 through the Inflation Reduction Act, the IRA. And what it did is that they took away the maximum amount of pocket for prescription drug medication in the United States. They brought it down to $2,000 per year. You used to be able to hit something called a donut hole at $5,000, $5,030, and some individuals would spend a ton of money on medications. So now they've put a maximum amount of pocket for everybody, for all the plans, Medicare Advantage and prescription drug plans. The most you'll pay, including your deductible, will be $2,000 in a year. So out of all my clients, there's only a few amount of people, let's say less than 10%, that are in this category. But those that it does that apply to, it helps them out a lot. Now, outside of Medicare Advantage, you have an option of a Medicare supplement. Medicare supplements are known as Medigap, and it's called Medigap because it fills the holes in original Medicare. So Parts A is going to have different co-payments for hospital stays past 60 days and 90 days, also for skilled nursing facilities. And it's going to have co-payments and co-insurances for Part B as well. And there's a deductible for A and B. So Medigap supplements cover these holes, and it depends on the insurance plan that you choose in combination with your original health insurance or original Medicare. The plans have been standardized by the federal government, and there's 10 plans to choose from. Plans A, B, C, A, B, C, D, no E, F, G, K, L, M, and N.
What's the plan?
So people get this mixed up a lot with Medicare because you have parts of Medicare and then you have plans of Medigap. So parts of Medicare are Part A, hospital, Part B, medical, Part C, Medicare Advantage, Part D, prescription drugs, and then you have Medicare supplement insurance, which is Medigap, and they have different plans. So they got plan A, B, C, D, F, G, K, L, and M, N. But at the end of the day, there's only 3 plans that people really go to, and that's going to be F, G, and N. So I'll go over that here in a second as well. But what Medigap does is it helps pay for like either your hospital deductible and co-insurance or co-payments, Part B co-insurance or co-payments and deductibles, the cost of blood, the cost for 365 extra days in the hospital, and also covers part of foreign travel care up to plan limits, which is usually 80%, and also for charges above Medicare's approved amount. Medigap does not include prescription drugs, dental, vision, or hearing, custodial care, or long-term care. So this big old chart is a lot of information. I don't know how well you can see it from here, but on the right-hand side, you have Plan C and F. Plan F, it covers everything, all the gaps of original Medicare. So it picks up your Part A deductible and co-payments. It picks up your Part B deductible and co-payments. And it picks up your Medicare excess charges. So you pay a plan premium, and if you go to the hospital anywhere in the United States or go see a doctor, your co-payments are paid for, your deductibles are paid for. It's like a set it and forget it. You pay your plan premium, you don't have to worry about anything else. The problem with Plan F is that it's only available to individuals who are eligible before January 1st, 2020. And that plan will continue to age out. It'll get more and more expensive over time. So what plan that people mostly use is Plan G, and Plan G covers everything that Plan F covers, except for your Part B deductible of $240. Plan G is like the Cadillac plan. Most people go to that. And then behind that is Plan N, which covers everything Plan G covers except for Medicare excess charges. And there are co-payments for seeing a specialist at $20. And if you go to the hospital, there's a co-payment of $50 if you're not admitted to the hospital within 24 hours. So a lot of plans, but really the only ones that are relevant are Plan F, G, and N. It is a lot of information. I know that's why with people want to know more, I'll sit down with them, explain to them, in detail, because this is still a very compressed amount of information. So enrollment periods for Medicare, You have your initial enrollment period, which is 3 months before your 65th birthday or 3 months after your 65th birthday. So that's 7 months in total during your initial enrollment period to acquire parts A and B. Okay, you have 3 months before and 3 months after. Your general enrollment period is going to be January 1st to March 31st. If you miss your initial enrollment period to get parts A and B, you can enroll in parts A and B the following year, January 1st to March 31st. And then you have until June 31st to apply for Medicare Advantage or prescription drug coverage, which is Part D. Medicare supplements, the open enrollment period, when you're first eligible for Part A and B, you have a 6-month window to get a Medicare supplement plan without going under medical underwriting. So if you have pre-existing conditions, it doesn't matter. They can apply for it, and that's when they get the cheapest or the most least expensive Medicare supplement options is when you're first eligible for it. Get it now, then versus getting it later. If you wait later after that 6 months, you'll go under medical underwriting, and that could cost you to either not get approved for the plan or have a higher premium for the plan.
She just turned 65 in May.
Okay. This coming May or this last May?
Last May.
Okay.
And she didn't work here, she only had the green card.
Only has the green card? Okay. So, married?
Widow.
Widow? Okay. So she would have to, she can get Part B, which is your medical. She can pay a premium for that based on her income. If she makes under $103,000, it would be $174.70. If she, no income? Okay, so, yeah, Part B, so she might be able to apply for Medicaid with the state, through the Social Services, Department of Health and Human Services. And if you apply for Medicaid, they will pay for her Part A and her Part B, depending on the level of Medicaid that she gets.
Yeah, she's staying with her son.
With her son right now? Okay, so I'm not sure of the residency for Medicaid. Medicaid is basically, it's a state and government-funded venture, and it's federally regulated, but the state basically has all the rules. So each state has different eligibility requirements for Medicaid. So she needs to definitely go to the Department of Health and Human Services, or at least call them and see what happens. Yep. And so I have an application I can send as well. You can fill it out and bring it down there, or you can just go down there and apply. But let me find out the Medicaid and how long you have to be, what the rules are for Medicaid, like how long you have to be a citizen or be alien or whatever it may be. How long has she had her green card? Two years? 4 years? Okay. So, you know what, I'm thinking about it now. So if you're a resident for 5 years, that's what it is, you can get Medicare. You have to be a resident for 5 years to get Medicare. Medicaid may be different, so I will check that for you. I will check the limit, the age limit, or not the age limit, but the citizenship requirements on Medicaid, or the residency requirements, should I say. Now with Medicare, you want to avoid any type of penalties. So there's special enrollment periods for Medicare as well. If you lose your group health plan, you have 8 months to enroll in Parts A and B without incurring any type of penalty, but you only have 2 months to enroll in Medicare Advantage or Part D. So you can incur penalties for not enrolling in time for Part D or Part B. You have to make sure that when you're first eligible, you go ahead and get that done and kind of stay ahead of the curve. And we only have a few things more to cover. So hospital indemnity insurance. What hospital indemnity insurance is that it pays for the co-payments associated with an inpatient hospital stay. It'll also pay for ambulance rides, critical illness, outpatient surgery services, and they also sometimes offer lump sum cancer riders. So whether you're on regular original Medicare or you're on Medicare Advantage or you're on Affordable Care Act health insurance, there's going to be some type of co-payment associated with going to the hospital or catching an ambulance. Regular health insurance co-payments are really high compared to Medicare and Medicare Advantage. Medicare Advantage, much lower co-payments. You might spend, let's say, $200 to $400 for a night in the hospital with Medicare Advantage, but with regular health care, like Affordable Care Act health insurance, your co-payment's probably going to be around $2,500 for one night. So you can design these hospital indemnity plans to help pay for those co-payments. And the rates can usually average around, let's say, $20 to $60 a month. It depends on the age and it depends on the level of the policy. So for about $1 or $2 a day, people can acquire these hospital indemnity products and pay for these huge co-payments if they come up in the event of a serious illness or injury, so they don't have to come out of pocket thousands of dollars. Because if you have that money, the last thing you want to do is give it to the health insurance company. Then you have dental, vision, and hearing insurance. They provide a range of important benefits. They're going to, and depending upon your age, and if it's you or you're married or your family plan, it's going to determine the rates for your dental, vision, hearing plans. And those are going to offer lower out-of-pocket expenses and for your coverage, whether you're going to get to the dentist to get your teeth cleaned or you're getting bridges or root canals or any type of comprehensive coverage as well. And then there's also cancer, heart attack, and stroke policies. These are really important, I think, for individuals that do have any type of cancer, heart attack, or stroke that runs through their families. And the younger you are when you get these policies, the cheaper they're going to be. And if you have any pre-existing conditions, like if you had a previous heart attack, you won't qualify for them. If you've had, cancer before, you won't qualify. It has to be within outside of 5 years. But if you get them in time and you get them now, like I know cancer runs in my family, so I know I'm going to get myself here a policy here as well very soon. I just started doing these, but they're really affordable. They're usually going to average maybe around $20 to $60, depends on the level of coverage that you're looking for. So basically, if you do get diagnosed with cancer or you do have a heart attack or something serious, the policy is going to pay you a lump sum of money for the event. So you can design them for $2.5 grand, $5,000, $10,000, all the way up to I think about $50,000, and that'll help you pay for the co-payments or the insurance cost of having, cancer, heart attack, or stroke. And then there's a final expense and life insurance. So final expense and life insurance are pretty much the same thing. What final expense is just smaller policies, and what it does is it helps individuals pay for their burial services if they have any debt or car payments or anything like that left over. So final expense, people that have a lower income usually will get a final expense policy, maybe for 5, 10, 15 grand. And so that's their loved ones don't have to pay for the cost of their burial if something were to happen. Oh, it depends on your age and the level of coverage that you want. So it could be $20, it could be $60. They all kind of average around that range usually. So I quoted someone the other day, she's 53 years old, and I think she wanted 10 grand. I think her policy was like $35. Pretty cheap. So she just unfortunately has had a lot of individuals pass in her family recently, and she's like, Justin, I need this now because I don't want this to happen to my family member. And so, and then life insurance policies can go up to, $250,000, and they can be termed or they can be life, or whole life, sorry. And so that's going to cover you, it's just a larger policy, right? So that's basically the difference between the two. Final expense is small, maybe up to 20 grand. life insurance can go up to $250,000 plus. So that's going to be determined by your age and the size of your policy too. And that's about it.